welcome to Village in Motion this Tuesday, January the 9th. I'm Clint Lambert, the host today, and we've got a very interesting duo here in the studio with us in the form of the medical director and the medical practice director with us this morning, Dr. Dar and Miss Crystal, and we're very glad to have both of you with us this morning.
Thank you for having us.
What's happening in the medical center these days besides the norovirus?
Well, a lot of good things are happening in the medical center.
Okay.
And instead of me talking about that, I will ask her because she knows better than what is happening in the medical center.
Because you're seeing patients, right?
Yes. And
there is a lot of good things happening. We're fully staffed. We can get up and dance to that.
Yes.
And we have it to where one CMA certified medical assistant is assigned to a physician now instead of changing it daily, so they can get to know the residents can get to know them.
Okay.
So we're doing that now. We are going to rotate that on a monthly basis right now, just so the CMAs get used to each physician.
Right.
And the physician gets used to each CMA. We want down the line it to be able to, if somebody walks in with a UTI, the CMA knows that that physician's going to get a urine sample. So they're going to do it prior.
A UTI is a urinary tract infection.
Correct.
Okay.
Correct. So they kind of know what their physician's going to want so that we can make it easier on the residents and do everything in a timely fashion.
Wonderful. You said you're fully staffed. So what does that mean from a number of people, types of people that you have in the clinic now?
We have the one front desk, which is Krishna, and we're not letting her go ever. And then we have 6 certified medical assistants.
Okay.
Prior, we only had 3 certified medical assistants and Krishna.
Wow.
So we have enough staff to accommodate the amount of patients that we see.
Okay. And there will always be somebody else besides Krishna on the desk, is that correct?
Correct. It will be a CMA, certified medical assistant, at the desk at all times, and that will be the person you ask your medical questions to so they can help you through it. If somebody comes in as a walk-in, they can triage the resident because they are clinical instead of having Krishna run to the back and come back up front. You come in with script questions. You ask the CMA, they're on hand. So we figured having a CMA at the front desk would help out a lot, not only with confusion, time-sensitive stuff for the residents that has to do with the medical side instead of having Krishna run back and forth, and she can just focus on what her position is.
Okay. CMA means Certified Medical Assistant.
Correct.
Right. And they are trained as for 6 weeks, 6 months?
yes.
Type situation?
Usually it's 6 months.
Okay.
I have to be honest, as far as the Virginia training, I'm not sure, but I do know in Nebraska it was 6 months training and then continuous training on what they feel their week in.
Okay.
And that is also going on. Lunch and Learns, we're about getting ready to set up now that we're fully staffed, where they can learn new things from wound care to ear lavages, so that we can take care of those needs as well.
Super. So what I'm hearing, Dr. Dar, you're expanding the services that are being offered.
Absolutely. Not only expanding, but also streamlining everything so that patients do not have to wait long, and they should not get any hurdle because we have more manpower.
Okay.
And we are more efficiently answering the phones. We are more efficiently entertaining the patients, transfer to the room, seeing the physician, and conveying the messages. Not only that, we are fully staffed for 5 physicians, 2 nurse practitioners.
Okay.
One more thing that we are very delighted to have is a clinical social worker.
Yes.
The clinical social worker is a big addition to us, and I think we will see the fruits of this soon.
Good.
She will be a main connection between the physicians and all other type of support, like nursing support, rehab support, hospice connections, and skilled care, hospital records, code statuses, and all these things, and coordinating what type of help the patient requires, which is facilitating to their health.
Oh, okay. So would she be the one that would help coordinate admission to the hospital and readmission back here?
Will help.
Okay. You said you have 6 physicians.
5.
Five physicians, 6 CMAs, right?
Correct.
All of those are full-time, 8 hours a day, Monday through Friday?
Yes.
Wow, that is tremendous. That's the first time that's happened in a long time.
Yes.
That is really great. Are there openings among those physicians for new residents coming in to be able to get a physician? I mean, do they have space for people coming in?
I think we are not returning any patient.
The only person that is not accepting new patients right now is Dr. B.
Oh, okay.
Dr. B is the only one not accepting new patients. All the rest of the physicians are.
Very good. That's excellent.
Excellent,
Very nice.
yes.
The other issue that all of the residents, and I think staff also are concerned about, and you mentioned it to start with, norovirus. What is norovirus?
Well, the norovirus is a virus. You know, it's viruses like, there are multiple things like bacteria and viruses. These are the two big classification of microorganisms.
Okay.
Viruses are very simple genetically, but they are very dangerous if they infect the human body.
Right.
Norovirus is one of the viruses that mostly affects the gastrointestinal tract. It means that the stomach, intestine, or the colon. Whenever the virus is infecting, it means that it is residing in the cell and starts to replicate or multiply. It causes localized inflammation. Inflammation means it causes swelling, redness, and pain. And because of this abnormal things, you start to have symptoms. And the symptoms of norovirus is sometimes it is symptomless.
Yes.
You can have a virus, but you are symptom free. But if you develop symptoms, then most commonly it's nausea, vomiting, abdominal pain, and diarrhea.
And that tires you out.
Yes. That.
Okay.
If and sometimes it's very lethal. There are about 685 million cases a year all over the world, and 200,000 deaths a year all over the world.
Wow.
So sometimes it's dangerous, but most of the time it's self-limiting. Once it starts affecting you symptomatically, the symptoms resolves in 3 days.
Oh, okay.
The thing you need to do is be well hydrated, drink a lot of fluid, and see your doctor, and whatever advice you get, you will be fine. But there is another problem.
Yes.
You're not concerned about yourself alone. When the virus is infecting you, it spreads to the community if you don't care or you don't take any precautions. So for your own safety, you need to see the doctor.
Okay.
And for your community safety, you have to take some precautions. The virus spreads through a fecal-oral route. It means mouth and related to the feces or secretions.
Okay.
So whenever you have a bowel movement, or you go to the bathrooms, or you get out of your apartment, or you meet somebody, or you go to wherever you go, any connection to any foreign person, you wash your hand.
Yes.
Before you leave and after you come back. Washing hand with the soap properly for 5 minutes is very important. That's going to protect you, the other community. The second thing is, if you have this virus, you have diarrhea, you have abdominal pain, nausea, vomiting, not only you call your doctor, but ask him, can I go out, or is it better for me to stay home? I think your doctor will tell you, for the community, it's better that you stay home and you call your friends who are willing to come to you and say, you know, for your health, that for your safety, please don't come now. The virus has an incubation period. Incubation period means that once it's in your body, it can cause symptoms after some hours. Then this virus incubation period is 12 to 48 hours.
12 to 48 hours. Once you're exposed to it before you start having symptoms.
Yes.
Okay.
So in 12 to 48 hours, after 48 hours, you can have symptoms, or before 48 hours, you can have symptoms, and you can be exposed for 12 hours and have no symptoms.
Right.
So incubation period is 12 to 48 hours.
So you said see your physician, but do you want somebody to walk into the clinic, or you want somebody to make a phone call?
I think it's better to make a phone call immediately and
Okay.
find out what's going on, but because maybe the office is closed
Okay.
and you go there and there is nobody. So it's better to call. They will tell you what is the situation, and they will tell you based on office condition that you come now or come after 2 hours, because if you come over there are a lot of patients and you are sitting there, it's mean there is a potential exposure to the
Yes.
other patients, so we don't want that.
Okay. Speaking of sitting there, and it's just go in the dining rooms as well. What do we do about people who have the norovirus, who touch the chairs and touch the books and those kinds of things, the menus in dining services? Are those things being cleaned and disinfected?
I think as far as I know, they are very active on these issues, and they are taking all the precautions that are needed
Okay.
based on CDC recommendations, and they are trying their best to limit this virus.
Okay. So it's very important for us then to make sure we let the physician know
Yes.
now that we got symptoms, or we think we have symptoms. Make a phone call to the clinic and find out, do we need to come down? Do we just need to stay in our apartment? What do we need to do? But to make sure through the whole thing that we're hydrated
Yes.
and drinking lots of fluids, not alcohol, right?
Yeah.
And to rest
Rest.
and take care and not expose ourselves to others.
Yes.
Right? So very
And
good. Yes.
one more thing that I think, because we are a very specialized community here, and there is a virus going on, so I will request all the personnel living in the apartments and independent livings that please avoid revisiting Garden Ridge at this moment.
Yes, yes. Well, memory care, cognitive care is blocked to people coming in, right?
Yes.
From the outside. So, and we don't want that to happen throughout
Yes.
Garden Ridge or throughout Green Spring.
Green Spring.
In regards to it. All right.
And this will ultimately will be fine, go away. One more thing that is important to know, that this virus keeps on shedding in when you have a bowel movements for at least 2 weeks after you are
Wow.
fine. So it's very important that you wash your bowel toilet with bleach properly.
Okay.
And be careful for at least 2 weeks after you get better.
So what I'm hearing you say is, from the time you start feeling symptoms until 2 weeks after you don't feel symptoms, really take care of yourself and make sure you're cleaning
Yes, yes.
well and disinfecting things from the toilet bowl to your hands.
Yes.
Not putting your hands around your mouth if you have not washed them, type situations. So very good. Thank you very much for that information, and we hope everybody follows it.
I hope so.
Crystal, we have 1 minute left. Anything else about the clinic?
Clint, I can't think of anything else right at the moment.
Okay.
Hopefully we have a lot more going on next month, but right now we're in a good place. It's
Sounds
only going to
good.
get better.
Sounds good. And that's good. And hopefully all of us will get better as well, right?
I hope so.
Okay. Folks, thank you very much for watching this segment, and thank Dr. Dar and Crystal for being with us.